While 2020 was defined by its vast and unprecedented obstacles, we will be defined by how we rose to meet those challenges. The many ways, large and small, that we adjusted to the problems presented, how we adapted old ways to new situations, how we created new procedures on the fly, how we overcame and became better. This is our story for 2020, an unforgettable year. 2020 defied everyone's best-laid plans. We all watched a global pandemic slowly creep across our country. The government reacted with shelter-in-place orders. Schools, places of worship, restaurants, gyms, and anywhere people gathered in large numbers were closed. For many workers, this meant an extended period of unemployment. Stock markets around the world responded with what some estimate to be the largest sell-off in history. People lost faith in how companies would operate in this unfamiliar landscape and wondered when all would return to normal. In this environment, a 400-year-old debate on social justice was brought to the forefront by the police killings of Breonna Taylor, George Floyd, and many others. People took to the streets to protest police brutality. Some of the marches turned violent as white supremacist organizations clashed with Black Lives Matter activists, and occasionally both would run afoul of the police. When the pandemic closed our doors, we were uniquely qualified to deliver distance learning to our students. For more than a decade, we have been routinely delivering synchronous learning between our two campuses and recording core lectures so students could review them when their busy schedules permitted. Nothing about this sudden shift was easy, but we didn't face the online learning curve that many institutions did. The college held countless training sessions on the technology for both faculty and staff. The IT staff and Rockford class coordinators sat in on all class sessions to ensure all lectures and recitations ran smoothly from the technology side. Faculty shifted and continued teaching their lectures either from home or from their campus offices, while the students watched and interacted remotely, all in real time. Pharmaceutical labs and experiential skills-based courses continued in a remote environment as faculty created videos for students to watch and discussed simulated patient cases in virtual small group sessions. Overall, faculty noticed that students were equally, if not more engaged than in person, and they were eager to chat online in the discussion box. In addition, attendance in core lectures was greater as students indicated they did not have to deal with the commute time to campus. The pandemic also put a strain on the experiential education program. Early on in quarantine, the college decided to suspend IPPEs, but APPEs could not be suspended if curriculum and accreditation standards were to be met for on-time graduation. As such, faculty and preceptors got creative in many ways, such as hosting journal clubs and case presentations via video conferencing, creating rotating on-site schedules for activities that could not be accomplished remotely, and incorporating students into telehealth visits or medication education sessions. These pioneering educators then led webinars and remote workshops to share their adaptations with others. This creativity detailed new ways to think about our experiential learning environments. The classes and experiential learning weren't the only things to move online. College activities and events had to be adapted to a virtual environment as well. The college awarded over $165,000 in scholarships to 75 students in a virtual ceremony. Over 200 pharmacists and pharmaceutical scientists graduated in our first ever online commencement. The Atkins Medicinal Plant Garden held its annual Garden Walk event online. The Summer Pharmacy Institute, a series of full-day workshops where students explored different areas of the pharmacy profession, was done remotely this year. Incoming P1 students were not able to get their white coats from an alumna this year, but still gathered online. Dr. Edith Nutescu became the Michael Reese Endowed Professor of Cardiovascular Pharmacotherapy in an investiture held via Zoom. 78 poster presenters gathered in individual Zoom rooms as judges popped in and out to ask questions about their research. Research Day also featured a keynote lecture and an award ceremony where nearly $30,000 in prizes was awarded. Student organizations and student-led virtual forums were also held online. In the midst of so much uncertainty, we not only provided the same world-class education we're known for, but we also expanded our residency and fellowship options for PharmD graduates. 2020 saw the addition of the Pfizer Health Economics and Outcomes Research Fellowship and the UIC North Shore Clinical Pharmacogenomics Residency. Arguably the greatest adjustment was overseen by our clinical and research teams. Dr. Andy Donnelly, Director of Pharmacy at the University of Illinois Hospital and Health Sciences Systems, faced drug shortages that caused them to adjust medication guidelines in order to keep things in stock. His team also needed to develop a special workflow to allow them to safely dispense to COVID patients. As the hospital reopened to all patients, the team created a 2-week stockpile to interrupt any future shortages. We persevered, we cared, we endured, Donnelly said. Given everything COVID-19 threw at us, that's no small feat. Clinical pharmacist Alan Gross, who specializes in infectious diseases, agrees with Dr. Donnelly. Amid this pandemic, pharmacists have been stepping up, having an even greater presence and advancing perspectives of their work, Dr. Gross said. Dr. Vicki Grew, clinical pharmacist at the UIC Heart Center, helped introduce telemedicine for follow-up visits to limit patient exposure. The college's ambulatory care pharmacies stayed open and continued to serve patients on the front line throughout the pandemic. Some of our pharmacists even worked directly with pandemic testing and contact tracing. When COVID reached Rockford, the Winnebago County Health Department reached out to the UIC Colleges of Pharmacy and Medicine to set up triage sites in the city. Drs. Annette Hayes and Chris Schriever set forth a detailed plan for triage, testing, and transferring of patients. On April 24th, their site opened, manned by the National Guard. Schriever and his team of pharmacists set about contact tracing. It was such a success that Dr. Schriever was asked to create a similar triage center to accommodate the west side of Rockford. At the west side location, Dr. Schriever and his team personally swabbed hundreds of patients throughout the summer. Researchers had a different barrier to their work. Most labs were shuttered in response to the pandemic lockdown. Experiments were interrupted, staff sent home. The labs all but ground to a halt. When they were able to reopen in the summer, it was with minimal staff and enhanced safety procedures. Despite these obstacles, the college's faculty continued to work on grant proposals and publish articles related to their groundbreaking research. UIC College of Pharmacy also had drugs discovered here enter the market in 2020. Professor Don Waller and Lauren Zainfeld's discovery, called Phexxi, became the world's first and only non-hormonal prescription gel approved by the U.S. Food and Drug Administration for the prevention of pregnancy and a potential to prevent sexually transmitted diseases. While Phexxi is not yet FDA approved for STD prevention, Waller expects that time will bear out its potential. My hope is that women feel empowered with a new option to protect themselves. A cancer drug also made steps towards the market. Dr. Deborah Tinetti, together with Dr. Gregory Thatcher, developed a new drug to combat breast cancer called TTC-352. Preclinical studies showed that TTC-352 causes complete tumor regression. Researchers found that there were no toxic side effects, even at high doses of TTC-352. Dr. Tinetti said, "This is very encouraging because these participants were at an advanced stage of their disease, and we saw that their cancers stopped growing for a significant amount of time." 2020 was difficult for the college, as it was for everyone, but the ability to pivot and adapt has kept us strongly in the game. Education, events, patient care, research, and every other aspect of this world-class institution have adapted to the new realities of pandemic life. I believe science and pharmacy can emerge better from these challenging times, said Dr. Mike Federle, director of the Center for Biomolecular Sciences. More resilient, more determined, more focused. We couldn't agree more. In addition to the human cost, the pandemic had a very real economic cost as well. With so many businesses being closed, the unemployment rate skyrocketed, causing economic concerns in every strata of life. In response, UIC announced a $15.9 million emergency grant program for students impacted by the pandemic. For many pharmacy students, the outbreak created enormous financial stress because of the loss of employment, additional demands associated with child or family responsibilities, or mounting student loans. Alumni John Plachecka and his wife Claire recognized this sensitive issue and provided 50 scholarships to pharmacy students facing financial hardships. Some people just do the right thing, said UIC College of Pharmacy Dean Glenn Schumach. He went on to add, they saw a need and they want to help. We can't thank them enough. The Placheckas are no strangers to philanthropic giving, especially at UIC. It was a donation from the Placheckas that made Posen Plaza a reality. The tables on the south end of the plaza are even named after Claire. Like the Placheckas, many alumni and friends have stepped forward to support our mission, establishing endowed scholarships, providing research support to our faculty, and funding that strengthens our teaching and service missions. This past Giving Tuesday, 191 alumni, faculty, staff, students, and friends donated over $60,000 to a variety of college funds, including scholarship support, providing important financial aid to our students. The protests over the murder of George Floyd touched off a series of long overdue discussions on the state of racial equality in America. Our P1 class is 23% underrepresented minorities. Our students speak over 30 unique languages. This topic hits us where we live. In an open letter posted to the college website, Dean Schumach said, "As healthcare professionals, we have long seen the effects of structural racism, not just in social and economic inequalities, but also in disparities in healthcare and access to care, the impact of which has become even more obvious in the disproportionate death rate of COVID-19 among African Americans and Latinx Americans." He added, "As a college, we are committed to advancing equality and inclusion, and we reject racism and racial prejudice in all forms. We wholeheartedly believe that every person deserves to be treated with dignity, fairness, and without discrimination. We stand together with all our patients, students, faculty, staff, alumni, and friends, regardless of race and ethnicity, and promise to take decisive action when we see injustice and inequality." In a symbolic show of solidarity, students, staff, and faculty participated in an event called White Coats for Black Lives. Participants took a knee for 10 minutes in public places in remembrance of Black lives lost due to intolerance and racism. The UIC College of Pharmacy is one of a few colleges of pharmacy to receive the Higher Education Excellence in Diversity Award. As a part of the service mission of the college, the school has over 20 community health initiatives in underserved communities. In order to ensure that our faculty also represent the diversity of the student body and population at large, we've created the UIC Career Program. The program is funded by the NIH to, quote, "develop a diverse group of highly trained scientists to address the nation's biomedical research needs." The program is a collaboration with the UIC College of Medicine, as well as Governor State University. The goal of the program is to build a culturally diverse group of fellows who, upon completing the program, are well equipped to be leaders in academia at research and teaching-intensive institutions alike. The march of progress is never finished. What seems fair and reasonable in the past may not in the future. We will not always be perfect in our pursuit. We can only promise to continually improve. As we look across the lessons of the past year, we're emboldened by the talents these adversities have uncovered in each of us, and eager to set them against the tasks that lay ahead in the new year. New alumni, new students, new challenges, new collaborators, new projects, even a new degree. In 2021, the college plans to begin admitting students to a new proposed undergraduate bachelor's degree program in pharmaceutical sciences. Once approved, this will be the first BS in pharmaceutical sciences in the state of Illinois. Students will be admitted to the program in their third year of undergraduate studies. This degree will allow students to track into the PharmD program and reduce the total time to the PharmD degree by 1 year for many. Those not moving into the PharmD will be well prepared for other health science programs, graduate programs, or employment in pharmaceutical companies or the healthcare facilities. And in the coming years, we will also be breaking ground on a new building. The college, in partnership with UI Health Cancer Center, the Discovery Partners Institute, and the state of Illinois, will be constructing the Drug Discovery and Cancer Research Pavilion. The building will be a new, state-of-the-art facility to house emerging areas of translational research. It will bring together industry partners, educational and clinical programs, and research to create the collaborative environment necessary to further drive innovative therapeutic discoveries. The Drug Discovery and Cancer Research Pavilion will be located directly behind the College of Pharmacy building at 833 South Wood Street in Chicago. It will be a 5-story facility dedicated to drug discovery and cancer research with a focus on breakthroughs and novel treatments for oncology, infectious disease, and women's health. The facility will also feature a technology park, ripe for public-private partnerships. We can't wait to continue this amazing journey into uncharted waters. The path ahead is never perfectly clear, but thanks to the lessons of 2020, we're much better suited to face the uncertainty.